So, Rhea, the first question we'd like to ask on the No Pain, No Gain session is focusing on the biological aspect of this subject. Can you explain what is pain and what you can do about it?
Yeah, it's a brilliant question. So, um, pain is quite a complex phenomenon. Its aim is to be protective. So, its aim is to alert you that something potentially is going on, and that you need to possibly do something about it. Because it's so complex, it takes multiple different ways to try and manage it. So, we'll go through a little bit about how we can best manage pain in a little bit. So pain is one of those essential things that we have in our body that helps us survive. So especially acute pain. So you tread on something, you put your finger on a hot plate, it alerts us to say that you're doing something that's a bit daft, something's going on, something's changing, and it's going to cause you potential damage. So it alerts you and makes you do things to get rid of that pain. So take your finger off the hot plate. So that's your kind of simplified version of what acute pain is. So that acute pain might be having had a surgery, so the pain that you get after the surgery, if you've broken your leg. So those are your acute pains. They often last for less than 3 months, so that's generally kind of the number that's given to it. And they tend to respond really, really well to our simple basic analgesias, so things like paracetamols, anti-inflammatories, morphines. And they're quite easy to manage. We know that generally they follow kind of quite a specific time course, and they get better as time goes on. Now, the other aspect of pain is your chronic pain or your persistent pain, which gets a little bit more complex. So in chronic pain, generally, it's felt to be pain that lasts longer than expected time of healing. So if you had surgery 6 months ago and you're still struggling with pain from it, then that would be classed as chronic pain. And with chronic pain, it comes a whole host of other issues as well. So with pain itself, with chronic pain, your brain and your nerves actually change. So the parts of your brain that process that pain starts to get bigger, and they start to become more efficient at processing those little pain signals that come from your body. So it becomes much more complex to try and manage. So you need many, many, many more tools in your toolbox to be able to try and manage it. And again, we'll talk about that a little bit. So pain obviously is multifactorial. So it has emotional aspects to it. It has the physical aspects, so what you feel with pain. So whether it's the throbbing, like when you've sprained your ankle, or when you've got horrible dental pain, that throbbing feeling, whether it's from nerves, so neuropathic pain, nerve pain, where it's very much described as burning, electric shocks, tingling, pins and needles. So all those kinds of sensations would be classed as neuropathic or nerve type pain. So you've got the physical aspects of it, so how it feels, and then you've got the emotional aspects and the social aspects as well, and we'll come on to those a little bit later in this session. So talking a little bit more about the different types of pain. So we've talked a bit about acute versus chronic. And you've also got your cancer pain, so pain due to the cancer itself, so where the tumor is maybe infiltrating organs or putting pressure on organs, things like metastases when they're in your bones, that can cause a huge amount of pain. You've also got the cancer treatment pain, so pain you get from having the surgery for maybe trying to get rid of the cancer, or the chemotherapy and radiotherapy to try and treat the cancer as well. So chemotherapy can cause that neuropathic pain, mainly in your fingers and in your toes or your legs, that burning and tingling, pins and needles, those buzzing kind of sensations, which can be really, really difficult to manage and can be really distressing for people to experience. Radiotherapy as well can cause pain. So some people will experience what you would describe as a burn, and those tissue changes that happen when you've had the radiotherapy. Also, it can cause damage to nerves as well, same as the chemotherapy can, particularly if you've had it in an area. So for instance, like breast cancer, radiotherapy for breast cancer can sometimes cause damage to the nerves kind of around that area, so the brachial in your armpit area. Or if people who've had pelvic radiotherapy, it can cause damage to the nerves in your spine that can cause damage to those kind of nerve plexus and can cause symptoms in your lower legs as well as your back and hips and things as well. So the treatment as well as the cancer itself can have those pains, and some of the pains will be that acute, will be quite short-lived. Generally the radiotherapy burn type pain tends to settle down after a few weeks of finishing radiotherapy. However, some of those pains will become more persistent and will become longer lasting, and may go on indefinitely. Unfortunately, they can become more like a long-term condition itself to try and manage, and that can be really, really hard. And again, we'll talk about that a little bit in one of the later sessions. So With regards to pain itself and what we can do about it, so we've got the cancer pain, which obviously for that you have the very specific treatments, like I said, the chemo, the radiotherapy, the surgery to try and treat it. And there's also medications that can be given and can be used for that as well. So things like basic pain relief, like paracetamol, anti-inflammatories. They may use steroids. So steroids are quite often used for tumor type pain, to try and shrink the tumor to take the pressure off the structures around it. And that can also be good for things like the nausea and loss of appetite that can come with it as well. Stronger pain medications like opiates, so things like morphine, oxycodone, fentanyl, those really strong, potent, powerful drugs are often used in cancer pain, and they're really, really effective often for cancer pain as well. But they can come with a whole host of side effects. So it's about trying to find that balance between managing the pain and making sure that you're not, so sedated or sick or anything with it that you can't manage and get any quality of life. Then you've got the cancer treatment pain. So this comes, with a whole host of other issues as well. The kind of psychological impacts of having that pain after having the treatment for the cancer and then having that pain still ongoing afterwards can be really, really hard to cope and can be really debilitating. But there are things that can be done. So again, you've got the same types of medications that can be used, but often for the more nervy type pain, you need slightly different medications. So you may need anti-neuropathics, so drugs like amitriptyline, nortriptyline, imipramine. These are low-dose antidepressants that can be used for nerve pain. So they help to kind of calm the nerves to stop them firing so many of those signals. You can also use medications that were traditionally used for epilepsy, so gabapentin and pregabalin. And again, they can be used to try and calm those nerves down so they're not firing as many of those signals, and it can help reduce then how much that pain you get. Opioids again can be used for really severe neuropathic pain, but they don't tend to be quite as effective, and they tend to come with a whole host of side effects with them as well. So it's a bit of trial and error, unfortunately, with pain. I would say it's a bit more of an art than it is a science to try and manage pain. It does depend on the individual and how you respond. And a lot of the time people will have so many different types of pain all affecting them at the same time. So it's a little bit about adding in other bits to try and manage that. The difficult thing with pain as well is that pain isn't always related to that tissue damage. So when we think about pain, we often think about, the surgery or the broken bone, something that you can see on a scan or that you can see in blood tests and things. But pain is, because of the complexity of pain, you can't always see on a scan or an x-ray or a blood test why somebody has such severe levels of pain. So for instance, perfect example, Lego. Most of us have got kids or have been around kids and have come across Lego and trodden on a piece of Lego. And it is the most excruciating thing in the whole world. Childbirth, nothing compared to treading on Lego. And yet actually we haven't really caused any damage to ourselves with it. So we know that there's no tissue damage there. There's no broken bits. You might have a little bit of bruising depending on how much you have trodden on it. But the pain, the severity of that pain doesn't equal what you've done. It's a bit like a paper cut as well. Such a tiny little cut, and yet it's so painful, especially if you eat crisps. So we have to take that into context as well. So it's really tricky sometimes to try and manage pain like that when it's so severe, and yet it's really difficult to try and put your finger on exactly what's causing it. And that tends to come into the chronic side more. So one of the things that I think is really important, especially for people after having cancer and cancer treatment with their pain, is that pain will often be that warning signal, that alarm bell that rings that says, is something wrong? Is cancer come back? Is this a recurrence? Has it got worse? And it's really important for people to get to know their bodies and to know what their pain is like for them. So what's their normal? So if you can get to know your pain and what your normal pain is, then it makes it slightly easier to know if you're just having an increase in your normal pain, which we call kind of a flare up. And then in that case, you can put things in place that can help you manage that, whether it's medications or whether it's some of the other management tools that we'll talk about, or whether actually it's a new pain that's very different, maybe a pain that you haven't had before, or the pain has changed in some way. And in that situation, it's really important then to still make sure that you speak to somebody, that you tell somebody, that you get somebody to look into it. And 9 times out of 10, it will be absolutely fine. It will be a muscle pull or a strain or a normal headache. But, after going through cancer and cancer treatment, it's really, really hard to find that fine balance between being really complacent about your body and thinking, well, this is just part of my life now, and being really paranoid that actually every ache or pain or symptom comes up. So it's really important to try and get to know yourself and get to know what's your normal, so that you know if something has changed and you can get support and help for that. Obviously, alongside cancer and cancer treatment pain, we may experience other pains as well. So people may well have other conditions such as arthritis or fibromyalgia. And in those situations, the pain management is very similar, medications, and some of the other pain management techniques. You can use them very much for the same. In pain, we don't have that many drugs and we don't have that many pain management techniques. So a lot of them can be used for all of them. So if there's a technique that you've learned to help manage your chronic non-cancer pain conditions such as fibromyalgia or ME or arthritis, you can use some of those tools as well to be able to help manage the cancer or cancer treatment pain. They're very interchangeable, so they're really good skills to have in general. So apart from the medications, which with pain is kind of a very, very small part of managing pain, the much bigger part that people don't always think about is the self-management skills and the non-pharmacological, so the non-medication ways of managing pain. So things like TENS machines, which can be great, often used in labor and pregnancy to help with pain. That can be really good for muscular pain or nerve pain. It can help with, can help to improve blood supply to the area. It can help the muscles relax, and it can help give your brain a different thing to focus on, so a different sensation. You've got things like acupuncture, which, although there's not huge amounts of evidence for it, there are many people who get really, really positive benefit from it. So if that's something that helps and works for you, then that's absolutely fine. And for some people, they do get really good benefit. And again, it helps to stimulate that blood supply to the area and helps to give the brain a different sensation to focus on. You've then got things like using heat and cold. They can be fantastic. So in the hospital setting where I work, often the nurses on the wards get really fed up with me saying, have you used a heat pad? The first thing we generally say for things like muscular pain, spasms, even broken ribs, those kinds of situations. So if you've got damage to the spine or anything like that, then often the pain can be caused by the muscles around the area where you have the fracture going into spasm. So actually things like using heat pads can be really beneficial for that kind of pain as well. Cold for some people is much better, especially if you're kind of menopausal. If you get hot flushes, putting a heat pad or a hot water bottle might not be what you want to do. So you might want to consider using an ice pack instead. I remember when I had the chemoneuropathy, originally having flip-flops on rotation. So flip-flops in the freezer in a bag and flip-flops that I was wearing. And then when the flip-flops that I was wearing started to warm up, I'd swap them over. And it was brilliant for managing that burning pain from the neuropathy. So you become quite inventive when it comes to trying to manage pain. Physiotherapy, exercise, fantastic. So not only does exercise help with kind of the emotional and mental health aspects, but also it's really good for boosting those natural chemicals in your body that help to manage pain as well. But I appreciate it's very difficult when you're in pain and if you're feeling very fatigued to do exercise. But when I say exercise, it can be anything. It doesn't have to be formal exercise. It can be any kind of activity. So whether it's, just playing with the kids, whether it's having a little dance for 30 seconds a minute in the kitchen, whether it's, doing some lunges whilst you're putting your shopping away, lifting your baby up, all of those things are activity and they're really, really good for your mind and body. Apart from that, there are other self-management techniques that go into more of the psychological and the social side of things, and we'll come into that a little bit more in the next kind of sections as well. But generally, I think the overall message is about just making sure that you know your body. And if you're not sure about your pain, whether it's normal for you or whether it's not, please always reach out and ask somebody for help. Speak to your GP, speak to your oncology team. And if your pain isn't managed, if you're trying self-management things, if you've tried the medications and your pain isn't manageable, then speak to your GP, speak to your oncology team. There are specialist pain services that can provide more specialist kind of advanced interventions. Things like injections and infusions and different kinds of techniques that GPs and oncology teams may not have access to. And also there are specialist late effects clinics around the country as well. Although there's not many of them, there are around and there are more and more growing. So they can also provide really good support for those more chronic late effects or long-term effects from the radiotherapy or the chemotherapy that you're experiencing that you may be getting pain from. So, do reach out. And places like Mummy Star Pelvic Radiation Disease Association UK if you've had pelvic radiotherapy and or chemotherapy. Eve Appeal, Joe's Trust, all of these different cancer charities out there, reach out to them as well. They may be able to signpost you to some services that may be able to support, or they may have kind of professionals on board that may be able to give advice and guidance as well.